This is Med School Radio, and we are looking at first aid again, the cardiovascular section, fetal circulation, often very confusing. You have to remember that a lot of it is reversed. So let's see what it says in first aid regarding this reversal. See if it can become a little clearer. First, blood in the umbilical vein has a PO2 of about 30 milligrams of mercury and is about 80% saturated with oxygen. The umbilical arteries have a low oxygen saturation. Next, they write that there are three important shunts to remember. First, blood entering the fetus through the umbilical vein is conducted via the ductus venosus into the inferior vena cava, bypassing the hepatic circulation. Second, most of the highly oxygenated blood reaching the heart via the inferior vena cava is directed through the foramen ovale and pumped into the aorta to supply the head and body. Number 3, deoxygenated blood from the SVC passes through the right atrium, then to the right ventricle, then to the main pulmonary artery, and then to the ductus arteriosus, then descending aorta. The shunt is due to high fetal pulmonary artery resistance, which is due partly to low oxygen tension. So those are the lists. They give the 1, 2, 3, the things you should know about the three important shunts. It then says at birth, the infant takes a breath, which leads to a decrease in the resistance in pulmonary vasculature, which leads to an increase in left atrial pressure versus right atrial pressure, which leads to the foramen ovale closing, and it is now called the fossa ovalis. Then the increase in oxygen from respiration and decrease in prostaglandins from placental separation leads to a closure of the ductus arteriosus. And lastly, we should remember what it says here: indomethacin helps to close the PDA. And then this becomes the ligamentum arteriosum, which is a remnant of the ductus arteriosus. So I hope you can remember all that, and we are left with a final sentence here, which shows some red E's and says, prostaglandins E1 and E2 keep the PDA open. Thank you very much.